great to be here. You know, as I was listening to Gap's questions and Paul's question about sustainability, I can't help but think and reflect back that I'm just very thankful that we are a consumer-governed organization in the very active changes of healthcare right now, both at the federal and at the state level. Just a little background, you know, when I think about health partners and the information you have here, to give you a little bit more information, you know, we have about 12,000 employees, and we really call them the ambassadors of our organization and the causes and the mission that we have to improve the health of our members, our patients, and the community that we serve. We currently serve basically the Wisconsin and Minnesota area, serving about 1.3 million lives. And we have, of those 12,000 employees, 700 are physicians, and about 55 of them are dentists. So you can see we have a very broad scope of services that we offer, both from a finance perspective as well as from a care delivery perspective. And our board, being that it's consumer governed, has been in place since the beginning. It is a 15-member board, 13 of which are actual consumers, and our members vote for them. And they are very engaged in that voting process. And I do believe that that engagement has kept us very focused on what we need to get done as the industry is changing so rapidly in healthcare. We have really had 3 areas of focus primarily. We call it our triple aim. And the triple aim is to really focus on the population health, the exceptional experience of individuals, and then really focusing on that low cost whenever possible. One of the questions Liz had presented to me was about during this economic times, has that been a struggle for us as an organization? And you know, when you think about how we've been spending our time the last several years, obviously we've all needed to, you know, hunker down, if you will, on what we need to do to be more streamlined and more effective. More importantly, what we've needed to do is continue to find those low-cost alternatives for what we can do to provide care to our members at hand. And our members are very engaged in those things. They want to know how we're moving forward to find those more affordable approaches. Fortunately, our administrative costs from a health plan perspective are one of the lowest, if not the lowest in the country, at about 5.4%, which is very, very low. That is great news. That's not where it stops. You know, our members definitely want us to continue. As their out-of-pocket requirements continue to expand, they clearly want to see what are we doing to help control those costs even more. So in the end, you know, the consumer-governed approach really has helped set our policy and direction of where we need to go. Healthcare, as you know, is extremely challenging right now at both the federal and at the state level. And fortunately for us, our board is very engaged in that process. What we've also done is very unique to us as an organization from the plan perspective is that our board is involved with what we call the appeal process. So if our members, we're a very heavily regulated industry, as you know, and if any of our members are not satisfied with the outcome of a decision regarding their care or benefits, they have the opportunity to come in front of our subcommittee of our board or the appeal committee and basically review their case at that time. It's not a requirement for us to do this. This is something that we do. It's very unique to us in our industry in itself. So, I mean, those are just some of the quick highlights about who we are as an organization. But I really look forward to the dialogue that we have in front of us and answer any questions that you may have.